The member for Kingston and the Islands.
Doctors came here Monday imploring the government to stop the crisis. They've left 2.5 million people in Ontario without a family doctor. In Kingston, the entrepreneurial CDK clinic moved ahead on its own in February, hiring staff and rostering new patients. But the result, a scramble to get in day-long lineups, was called the Hunger Games of healthcare. Besides all the people without family doctors, the problem is it's hard to pull them off the Healthcare Connect waiting list, even 8 months later. Getting data should be Management 101. My local Ontario Health team, which is setting up the system to connect people to family doctors and health homes, would be helped a lot if they could know all their local people on the wait list. No private health information has to be released. When it comes to the family doctor waiting list, why can't this government help local leaders innovate and get it done instead of keeping central government control?
Deputy Premier and Minister of Health.
Thank you, Speaker. You know, on Monday when I sat down with the OMA, we had a good conversation about how, in fact, Ontario is leading Canada with 90% of residents matched with a primary care provider. We know we can do more, which is why on Monday I was so pleased to be able to ask and task Dr. Jane Philpott to make sure that we continue on our path. You know, in February, when we announced 78 new primary care multidisciplinary teams, it was an exciting time for communities across Ontario, in Kingston, in Minto Mapleton, to ensure they've already hired and started to take on patients who have been looking for primary care providers. 78 across Ontario. By bringing Dr. Philpott on, we're actually going to be able to continue to work and increase that 90% number so that within 5 years, we will have 100% of the Ontario residents who want a family physician having access to it.
Thank you. Supplementary question.
The City of Kingston, hearing the people's cries and not waiting for this government to get it done, spent $1 million to recruit healthcare staff, including $100,000 for the Greenwood Clinic to hire RPNs and support staff and free up family doctor time. 2.5 million Ontarians don't have family doctors, and this government is only starting to ask around for help. So here's some advice. Build on local leaders in Kingston who've had success on their own. Thanks to local initiatives, Greenwood Clinic cleared the Healthcare Connect waitlist in their geographic health home on October the 8th. Why hasn't this government provided family health organizations like Greenwood funding to build up staff or add allied health professionals and connect more people to family doctors? Why should the City of Kingston have to get it done on its own?
Minister of Health.
And why do the independent Liberals continue to vote against our investments in primary care? You know, in addition to the 78 new and expanded primary care multidisciplinary teams, we also invested $20 million funding to boost existing teams because we know that we have exceptional world-class clinicians in the province of Ontario who want to provide care in their communities.
Order.
And they have a government who's going to get it done. Whether it is expanding primary care, whether it is new medical schools in Brampton and in Scarborough and in York Region.
Independents come to order.
Every single medical school in the province of Ontario having additional access and medical seats and residency seats. Northern Ontario School of Medicine has over almost 50% increase in their medical seats. Why do we do that?
Response.
We do that because we know
Independents come to order.
Ontario students in Ontario, they stay, they practice, and we become the beneficiary.